As May is Family Month here in South Korea, there's been a greater amount of attention on the well-being of children, especially amid the ongoing COVID-19 pandemic. Since the virus broke out, access to decent food, healthcare, education and safety have become all the more precarious for millions of children around the world. What are the realities of children's lives and their needs, and what can be done to better the conditions facing neglected children? For this, we connect with Chair of Save the Children Korea and South Korea's former ambassador and permanent representative to the United Nations, His Excellency Ambassador Joon. We also have Dr. Kim Yae-jean, Professor of Pediatrics at Samsung Medical Center and Sungkyunkwan University School of Medicine. Thank you both so much for joining us this morning. And
thank you.
Well, let's go straight into the questions. Now, let's start with you, Ambassador Oh. Now, COVID-19, the virus may not have been as fatal for children as it has been for older age groups, but what are children's rights and how have they been compromised throughout this pandemic?
Well, the United Nations has already declared the current situation as a broader child rights crisis. As we know, all over the world, this pandemic, COVID-19, is driving humanity into the worst humanitarian crisis of our time. The negative impact is particularly harsh on the vulnerable groups in our society, which of course include children. Most areas of child rights and child protection have been affected, and children's access to food, education, and healthcare, for example, has been seriously disrupted, while family finances are being hit hard.
And Ambassador Oh, who would you say are the most vulnerable children that we should be paying the most attention to right now? And what key areas has Save the Children prioritized in its response to the pandemic?
Well, we in the Save the Children are paying special attention to child protection and education. Over 1.6 billion students cannot go back to school yet due to the lockdowns. For the first time in recent human history, an entire generation is having their education disrupted. Korea might be lucky that to a certain extent we can make up for the problem with the remote education technology, but in many developing countries, students have to face a huge interruption in their learning. A recent report revealed by Save the Children says that even when the crisis is over, nearly 10 million children may never return to school.
And that's a huge gap, isn't it? And they don't have the same kind of digital technology that children here in South Korea have. So a big problem that you mentioned there, Ambassador Oh. And well, bringing you into the conversation, Dr. Kim. Now, there hasn't been a great deal of attention given to the health of children throughout the COVID-19 pandemic, as the focus was on the older age groups, the senior citizens, for instance, because it was widely believed that the virus isn't as fatal or harmful to children. Is this true? What are the major ways that children have been affected by the pandemic?
It is true that children are generally mildly sick or asymptomatic, and however, some of the children with underlying conditions, such as congenital heart disease or chronic lung disease and other immunodeficient conditions, they can have a serious condition. But most children can go well without serious complications. However, children, they are also affected in many ways because of the COVID pandemic. There are, so the already mentioned that direct impact would be, when they are infected, they can be mildly sick or they can be really sick, and they can be also isolated at some point. But also there are some indirect impact as well. And those indirect impact, we can think of some short-term health effect and also other effects due to the health system changes. The short-term health effect could be indirect health impact, could be also some of them can be actually go on long term. There could be injuries, communicable diseases, obesity, some mental health, and the security issues, including domestic violence, abuse, and neglect. And some of those injuries, because they don't go out and the school is closed and they have less exposure to the sports activities and less possibility of road injuries. So the injury is going down. And because of the school closed, there are less of mixing among children. So the communicable disease is going down. But because they stay at home, the obesity is going up. And the mental health is also an issue for children because they worry about this COVID situation. They worry about infection, and anxiety is also increasing. And as already a ambassador mentioned, the security issues in children is also an important issue.
Right.
And the health system access is also an issue as well.
Right, and particularly in developing countries, not having access to decent healthcare means that they're not going to get as many vaccinations that they need for other diseases, and also not being able to go to school. That provides challenges to sort of sanitation and nutrition as well. So lots of challenges that children are facing in those parts of the world. But have you noticed or experienced any changes among your patients, physical or mental health?
So some of the findings that I see in my outpatient clinic, as a pediatrician, I check all the time their growth and the weight and the height. And several children, the weight gaining curve is getting steep. So those things that I see at the moment. And the mental health issues, it's not much where I see at the moment, where I practice at the moment. However, some of the COVID patient, pediatric COVID patient, when they are actually diagnosed and they are worried about the conditions and they're worried about this disease. So that's also anxiety issues for children as well.
And while we're talking about anxiety, Ambassador Oh, there have been growing reports of domestic violence, exploitation and abuse of children throughout the pandemic. How severe has the situation been, and how has Save the Children been responding to all of this?
Well, when it comes to child abuses, we seem to have different conflicting reports, because some of them have seen a rise in child abuses, while others see a decline. But we shouldn't be misled by these reports, because even a decline in child abuse reports might be a dangerous sign, because it could mean that children are not properly protected by usual whistleblowers. You know, whistleblowers are teachers and caregivers or doctors. So because children don't have access to these caregivers, that might explain why in some reports child abuses cases have gone down. As many children spend more time at home, parents and other caregivers' burden has also grown heavier, and in some cases children are left alone, raising the risk of getting neglected. Another common problem Save the Children is witnessing, especially in a country like South Korea, is especially for teenagers, their digital media consumption has grown dramatically, putting them at a higher risk of online abuses and online crimes as well.
Right, so they're very much more vulnerable to these kinds of risks, and well, we should be paying a lot more attention to them. But Dr. Kim, children who are living in poverty or in inequality, they're getting much less attention than is needed. They're having less access to good food and nutrition. You know, while in some countries there have been reports of increase in junk food consumption and obesity. What long-term risks do these nutritional sort of challenges pose to children and their growth?
That's a very important question, because obesity and malnutrition are both important health threat to the health of children. And nutrition is really essential for physical growth, development and maturation of children. And it is also important for their emotional and intellectual well-being. For high-income countries and high-income household, obesity, because they stay at home and they eat more food and eat more junk food, the obesity at childhood, during childhood, could be a lead on to the adulthood obesity, and that can be linked with many adulthood chronic illnesses for diabetes, hypertension, and other chronic diseases. That could be an issue. But also in nutrition, in under malnutrition in low-income countries, in a low-income household, that could be also an issue, because in some low-income countries, maybe some children going to school and having lunch at school could be the only meal they can have during the day. And if they don't go to school, they cannot have those meals properly. So that can be also a malnutrition, and this malnutrition affect their physical growth and mental maturation, and that will affect their adulthood life. So that's another serious consequences as well.
And Ambassador Oh, at the moment, we're seeing a strong wave of COVID-19 resurging in South Asian countries, namely India. What is your biggest concern for these children in those countries, and how has Save the Children been supporting them, children in India, for instance?
Well, in India, as a result of this ongoing crisis, the number of children living in poverty and hunger could soar by millions. While children might be at a lower risk of contracting COVID-19, as you mentioned, they are not immune to the consequences of the pandemic surge, as their families and teachers are infected and unable to support them. So overall, rising poverty, lack of access to food and healthcare will have devastating effects on millions of children. Save the Children is working in close cooperation with the local authorities to provide healthcare supplies to communities, including oxygen, ventilators, and medicines. We also offer cash grants for families who have lost their source of income. And in fact, in Korea, Save the Children Korea has received quite positive response from Korean public to our appeal to support such children in crisis outside Korea.
Right, and they definitely do need those oxygen, that oxygen and the hospital supplies, which are so in such shortage right now in India. And well, Ambassador, now before we go, there isn't, oh, this can't be stressed enough, but there isn't enough focus on children at the moment amid this pandemic. Is there a message you would like to give to our viewers watching and also the wider international community?
Well, as the pandemic situation is prolonged, I think we should pay more attention to children, especially in their protection and education. You know, after all, when the crisis is over, when the dust settles down, what will be left for us will be how we go back to normalcy and rebuild our future. And children are our future as they constitute the next generation. We must do our best to minimize the long-term impact of the pandemic. We should not let what we are missing during these difficult times to become a curse for our next generation. For that, we need more proactive policies by the government and more active engagement by all segments of society in protecting our children.
Right, we really need to think of the future and, of course, the future. Our children are the future. Well, that was Ambassador Joon, Chair of Save the Children Korea and South Korea's former ambassador and permanent representative to the United Nations, and Dr. Yae-jean, Professor of Pediatrics at Samsung Medical Center. Thank you both so much for your time today.
Thank you, Suyong.
Thank you.
And to our viewers, as always, thank you very much for watching.